All right, we're live. Hi, everyone. This is Dr. Magda Majet, and this is the Embracing Joy podcast, where we speak with high achieving professionals and discuss ways that they can embrace more joy in their lives. I have a special guest with me today. So, my special guest, you probably know her or if you've seen her. If you haven't seen her on YouTube, you haven't seen her on the Black Doctors online. If you haven't seen her on the TEDx, today you'll see her. But let me tell you a little bit more about her. She is the visionary founder of Total Weight Care Institute. This is Dr. Catherine Toomer. She's devised compassionate and comprehensive health care courses for patients and practitioners. And her work draws from her own health journey and radical transformation with a 100-pound weight loss and reversal of type 2 diabetes. Her courage doesn't stop there. She's overcome many challenges, including heart disease during her pregnancy. And she's turned her struggles with her weight and her health into triumphs, not just for herself, but for the community at large and her patients additionally. And she continues to move forward, changing the way we care about people who are overweight. Her academic credentials include she graduated from Michigan State University College of Human Medicine, and she did specialized training in community health and family medicine
Yeah.
at Shands Hospital at University of Florida. She's committed to health and wellness through public speaking as a TEDx speaker, where she's spoken powerfully about topics ranging from health and wellness and weight loss to tackling the myths of imposter syndrome and advocating for comprehensive patient-centered weight loss treatment, where she addresses bias, prejudice, and shaming within the medical community. She is a beacon for change, not only changing lives through her institute, but leading the conversation on compassion and equity in healthcare, especially when it comes to weight bias. So thank you so much for being here, Dr. Toomer. There's no one else. Thank you. Well, you're welcome. Yeah. There's no one else that I would want to really have this that you're top of mind when I think of this conversation because of all of that experience that you've had and what you've speak and also educate about. I think this topic of self-acceptance and is so important. And I would love to discuss these topics with you a little bit further. So I really appreciate having you on this episode. So thank you very much.
Thank you.
So we're going to start with a game just to loosen up. So I think that all of us, as adults and professionals, we got to make time to play a little bit, right? Within our day and bring ourselves joy. So this game is an improv game and it's called Mind Meld or Convergence.
Oh.
So it's a fun one to play via, virtually because all it takes to play virtually because you can play with just two people.
Okay.
So how we'll play is you will say the first word on the count of 3. You'll say the first word that comes to mind.
Okay.
And I'll say the first word that comes to mind. And the goal is to get our minds to converge so that we say the same word. For example, if I say glove, and you say pink, and then we come up with a word that matches the two, which may be boxing or something, right? Or Michael Jackson.
I always think Easter because church gloves at Easter time. I might be dating myself because I don't think little kids wear gloves to Easter.
Church gloves sometimes.
So all right, so let's go ahead.
All right, so let's play. And the goal is to not get too specific because then we kind of will get stuck. So we try to keep it
Keep it
broad, but
general. Okay.
yeah, keep it general and
All right.
pick something that connects the two.
All
Okay.
right.
All right. So on the count of three, say the first word that comes to your mind. Okay. 1, 2, 3.
Joy.
Tissues. Tissues and joy. Joy
Tissues
is
and
that's a
joy.
great one. Tissues and joy. Okay. 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 Ready?
Mhm.
1, 2, 3. Wedding.
Weddings.
Ah! Ah! Wedding. Wedding.
I was like, happy tears. Where are you
Yeah,
having
happy
happy
tears. I
tears?
see
Weddings.
exactly
All
what
right.
you
Wow.
mean.
We got through
Wedding.
that really fast.
That was really fast. Our minds are already synchronized
Mhm.
a little bit, so we were able to meld them
We're
pretty
good.
quickly.
We're good.
That's great. That's great. Okay. So I have some questions for
Mhm.
you, Dr. Toomer, in general. So throughout your career, you've really been a vocal advocate against bias, prejudice, and shaming in medicine and weight loss treatment.
Mhm.
And how do you believe that these societal factors impact our ability to embrace our body acceptance and joy?
Um, it really impacts it, and not in a very good way.
Hmm.
The reason is that we start getting messaging really young, a very, very young age of what is considered good, what's considered bad, especially at a time when as children, like around 3 to 4 years old, you start trying to figure out what's good and bad, and you start noticing differences. That's, start learning to differentiate between peoples and different things.
Hmm.
And when you have subtle messaging that being large is bad and being small is good,
Hmm.
unless you or being large is bad because you're either a bully or you're overweight and you're lazy, or if you're small, then you're smart and wiry and all these things. Ooh, I apologize for that. I thought I turned my ringer off.
Okay.
Um, and so I'm just gonna take a second to turn off my sound. I usually
No
do that before I start. I apologize. Anyway, and so what happens is that your children get this messaging, and then we grow up with this messaging. Children are also, um, well, I should say, humans in general are not always very kind, and so those messages just get reinforced and reinforced and reinforced, and we're still seeing it today, even though we know that so much of weight gain is metabolic, so much of it is from our brain central, and it's all tied together, and our behaviors are also connected to our metabolic processes and our genetic code. And yet, those biases and prejudices are just so difficult to get rid of, which, we see it in other social instances as well. But
Mhm.
this is just probably the last acceptable one.
Mhm. Mhm. Yeah. Yeah, because it's been touted as something that's good for them, right?
Mhm.
So not it is, but it's kind of touted that if you're overweight, regardless of how healthy you may be, if blood work's normal, everything's normal, very active, it's
Mhm.
still frowned upon, right?
Yeah,
But
it
we know it's
is.
still in medical, in
Absolutely.
society, and also in
Mhm.
as a physician in
Yeah.
clinics, that's
Mhm.
something you will still address. So yeah,
And there's
definitely,
a
definitely.
fine line, because you need, in order to empower, in order to make change, to
Hmm.
transform in any way, you have to be empowered in some way.
Hmm.
And that empowerment comes from how you feel about yourself. And
Hmm.
so often when you feel really good about yourself, then you don't feel the need to change. So it starts this kind of this vicious cycle, which is fine. However, the only time it matters is when someone's health is at risk. And not
Hmm.
just their physical health, but also their psychological health. And you can't get to a joyful place when any part of that is being affected, whether it's your biology, your psychology, or your
Hmm.
um your social interactions and your social contacts. And so it's I think that probably physical is the least. of the three that affects our joy. But
Mhm.
the psychosocial is definitely very impactful.
Wow. Yeah, definitely. So, what would you recommend, or what would you say are some tools that you've been able to put in place for yourself or that you've taught to patients, individuals, so that they can appreciate themselves where they are so
Mhm.
that they can get to where they want to be, but not in a place of shame or self hatred, but in a place of, I love myself as I am, but I'm going to treat myself well
Mhm.
and get the care I need
Yeah.
to be happy and joyful in my body.
Well, there's a couple of ways. One is to be very careful about how we speak to ourselves.
Mhm,
And sometimes that's like a muscle. It takes time, it takes practice because we're very quick to criticize ourselves in lots of different ways.
mhm,
Unfortunately, our body can't tell the difference of a bully, whether that bully is someone else or ourselves. And so
mhm,
it's really important then to learn how to reframe our criticisms and to be kind to ourselves. One way of doing that is affirmations. Another way is gratitude journaling. And then another is imagining whatever you're saying to yourself being said to a loved one,
mhm,
your child, your mother, your sister. And how would you feel if you heard someone say that to them? If it's something that would bother you being said to someone you love, then it should bother you being said to the person you should love the most, yourself. And so that's a good tool. If you can't tell whether you're in that space or not,
mhm.
transplanting yourself out, putting someone else you love in, and then seeing how you view what you're saying.
I love that. I love that, especially, treating yourself like you would treat a friend, right?
Yes.
Yeah,
Mhm.
definitely. We can't be our own bullies. We can be, but
But we
we
often are.
shouldn't. We
We're
often
often our
are.
worst bullies, unfortunately.
Yes, the worst. The other
Mhm.
bully left in third grade, but you're still hanging on, or middle school, but you're still hanging on saying bad things to
Mhm.
yourself. So it's important to
Mhm.
treat yourself well as
Exa
someone that, because if someone was saying something that way to a friend, or you would
Mhm.
defend them,
Yes.
try to defend
Exactly.
yourself from yourself.
Exactly.
Hmm.
Exactly. And then also realize that our body is reacts to what we say or do to it.
Hmm.
And so if we're not kind to our body will not be kind to us.
Hmm.
If we're not kind to ourselves will not be kind back. And so it just starts a really bad vicious cycle.
Yeah, that's so important.
Mhm.
Thank you. And that's just so those strategies can be implemented. So those are strategies that are not very expensive to do,
Don't cost
right?
anything.
Don't
You
cost
it
anything.
don't cost anything to be nice to yourself.
Doesn't
It
cost
costs you a
anything
lot
to be
when you're not you lose a lot of it costs you
nice.
when you're not nice to yourself, but
Hmm.
it doesn't take a lot. One of the things that's really easy, I mean, most of us have a mirror.
Hmm.
Get up close, look at yourself in the eye, and then just get in the habit of smiling and saying nice things to yourself.
Hmm.
Um, and one of the stories I like to tell people is like I used to ask patients, or sometimes when patients would say, "I don't like the way I look. The way I look bothers me," and I was like, "Really? How much do your eyes weigh?" And they were like, "What are you talking about?" And I
Hmm.
was like, "Well, when you look yourself dead in your eye, like up close to a mirror, what do you see? Like, my eyes?" I was
Hmm.
like, "Do you not like your eyes?" Like, "No, I like my eyes." I said, "Well, then how much do they weigh?" It's obvious if you don't like yourself because of how you weigh, then it's not that you're looking at it's where you're looking and how you're looking that's making the difference.
Hmm.
So it's
Yeah.
not the weight. And so, that's always like a first step, and, most people look at me like I'm crazy, but it
Well,
works.
it's pretty profound. Like that's pretty profound because we're looking into, the eyes are a window to the soul.
Yes.
Right? So you're looking into your soul, you know,
Yes.
and
Absolutely.
you are looking into like your essence and being, and you're much more than your body, right?
Yes.
So we all are much more than our body. So it's a
Yes.
nice, when you look into the mirror, just to remind yourself,
Mhm.
I am much more than my body. I am, a
Mhm.
miraculous being. It's a miracle that I'm even on this planet. So I'm
Mhm.
going to appreciate myself, right?
Exactly.
And for my soul. And then I'm going to treat myself in accordance as best as I can, right? So
Exactly.
yeah,
Yeah.
yeah. But that, I mean, that's pretty profound what you said,
Yeah.
because looking into your eyes like that. Yeah, because we look into our stomach, we look into their sides, we look into the rolls or whatever,
Mhm.
whatever it is, or what's too
Mhm.
small or what's too big. But look into the
Look in your
essence.
eyes. Mhm,
Yeah.
and get in the habit of and you'd be surprised how many people do not look themselves in the eyes. They won't look themselves in the eyes in the mirror,
Hmm.
and that's the first place to start.
Hmm.
Get
Yeah, they may be.
comfortable.
Yeah, it could people we get distracted, right? Because you've been
Mhm,
told certain things about your face,
mhm,
or certain features, and then when you look in the mirror, you see that. You don't see
mhm.
your eyes, but you
Well, they
just
get up close.
look up close.
Get up
Get
close,
real,
real close, like
real, real
really close.
close. Really
And no, but really, so that you can't
Mhm.
really see anything else but your eyes and just
Nice. Mhm.
smile,
Mhm.
you know?
Smile. Yeah,
Smile.
definitely.
Yes.
Yeah. So thank you so much for that. There's another question that I have about
Mhm,
this imposter syndrome, right? So
mhm.
imposter syndrome, I know you did a TEDx talk on imposter syndrome,
I did.
and I think you mentioned that it's bravery, right? It should
Yes.
have another
It is.
name. It should be called bravery.
Yes. Mhm.
Can you expound more on that and how it ties into self-acceptance?
Well, the initial term was imposter phenomenon. And
Mhm.
what imposter phenomenon was actually coined by two sociologists who said that it was a feeling of like you didn't belong or you felt like you were an imposter or fraud based on out, I guess, outstripping your achievements, outstripping your coping mechanisms,
Mhm.
basically. Which, we all do as we're developing, as we're growing. We're always in a space where we get a little uncomfortable,
Mhm.
which is fine. But usually, where that came from was messaging from society. It was always deemed a marginalized group, particularly women, was who they studied initially. But they found that in any marginalized group, for any reason, it could be socioeconomics, it could be, race, it could be age, ableness, anything can lend itself to people feeling like you don't belong where you are. And that
Mhm.
lends itself to imposter phenomenon. It
Mhm.
was based on societies doing things.
Mhm.
Then it became imposter syndrome. And what that did is shifted the pathology from society to the individual.
Mm. Mhm.
And essentially, what it meant is that people felt like they were frauds, they didn't belong, they did that somehow they didn't have the credentials that were necessary in order for them to be where they are. However, in those situations, people do one of two things. They either sabotage themselves, and it's a self fulfilling prophecy,
Mhm.
or they work extra hard to prove themselves, and then they develop higher. They get they keep getting elevated and elevated and elevated. So what
Mhm.
happens when anytime you get used to something, you're in a situation, eventually you get used to it. And when you work really hard, you go up to the next level and then it
Mhm.
starts all over again. You get uncomfortable, then you get used to it. Then you get
Mhm.
uncomfortable and you get used to it. And so my point is being it's a phenomenon based on feeling unsure, nervous, feeling the need to protect your psyche, protect yourself from stress, and yet you work through it and you work above it. And in any situation where someone does something in fear and they work above it, anytime someone does something in doubt and they do out of faith, or
Mhm.
any of those things, in any other situation, we call it bravery.
Mhm.
Except when we self-label label ourselves with imposter syndrome. And it's a self-label, and the way to get over imposter syndrome is to simply stop saying you have it.
Mm.
It's just normal growth. It's normal
Mhm.
feeling of
Mhm.
normal development. Everyone gets scared.
Right. If it's a new position, you
Mhm.
have a lot of responsibility. Everyone
Yes.
gets scared. Yeah.
Yeah.
And you are, a lot of the times, you're either the only one or it's very new for you, and that you
Mhm.
just need mentors and you need to,
Mhm.
continue on doing it afraid to an extent,
Mhm.
But yeah.
Yes. But when you do
Yeah.
things afraid, that's not imposterism.
Mhm. Mhm.
And then plus, and one of the things I say in my TED Talk also is that being a fraud takes intention. You have to be intentionally trying to defraud someone to be a fraud.
Mhm.
And when you have what's called imposter syndrome, it's not you're not defrauding anyone intentionally. It's just a situation that's been superimposed on you. And so, it's really, it's not a syndrome for one thing, because you can't cure yourself from a syndrome, and
Mhm.
this is definitely fixable. And the other is that you're not an imposter. So if you're not an imposter and you don't have a syndrome, then you can't have imposter syndrome.
Mhm.
So just simply stop saying you have it. Just say you're scared. Just label the feeling instead of
Mm.
labeling yourself.
Mhm. Yeah. Tell me more about is the so it's accepting that this is new for me. I'm
Mhm,
scared, but I'm trying my best, and I'm
mhm,
gonna take it one day at a time, scared, and I'm gonna ask for
mhm.
help and keep doing it that way, and then you'll
Yes.
move past it rather than hiding and overworking and, you know, dealing with those anxious thoughts by yourself, that
Mhm,
that can, of course, cause a whole sort of different issues, but
mhm.
taking that into account. So
Well, it
thank
all
you.
feeds back to what we were saying earlier about what you say to yourself.
Mhm. What you say to yourself.
Yeah.
Yeah. Yeah, and accepting yourself about where you are and
Mhm.
where you are in that time. Yeah. Okay. Well, I have 3 final questions. These are my wrap-up questions. This was a
Okay, go
wonderful
ahead.
time. So, Dr. Toomer, who is a model of joy in your life?
Oh, wow. So
Mhm.
many. My mother,
Mhm.
she can find something of value anywhere, and then she takes joy in that. Children, anywhere.
Mhm. Mhm.
I just seeing children just have a way of, um, pulling the humor, the laughter, the feeling of joy from any situation. And
Mhm.
then my family. There's a level of laughter that happens within a loving family that you just don't have anywhere else. It's like, and then when I say family, that doesn't mean necessarily blood family. It means family you've created or family you were born into. But either way, there's a joy that we feel when we're together and we're supporting one another and we say something funny and you just really truly find um it's just joyfulness.
Mhm. That's
I
great.
That's the best way of putting it.
So what if you were baking a cake of joy,
Mhm.
are those your top 3 ingredients, or do you have, 3 different ingredients that you would put in your top
Well,
3?
those are where I see examples of joy and where I
Mhm.
would, but actually what I feel are the 3 things that lend themselves to joy is
Mhm.
observation, adaptability, and flexibility.
Mhm.
And objectivity, I guess, is another one. When you don't take things personally, when
Mhm.
you're able to pivot on a dime, when you're able to see things for what they really are, it's easy to find the joy in a situation. If you're all caught up in your feelings, you know, and those feelings aren't positive,
Mhm.
then it's very easy to have your joy stolen. And so, if you don't want people to steal your joy, don't give it to them for the first of all. Um,
Yes, don't give it to
don't give
them.
it away. But the
No.
other is, being able to be objective when stuff happens and you're just like, it's not about me.
Mhm.
It's just, it's about the situation. And it's easy then to find something else that you can focus on. It's like finding a silver lining in any given situation, finding the lesson. And sometimes finding, if you enjoy learning, finding that lesson brings you joy.
Mhm. That's great. Well, thank you so much, Dr. Toomer. This was a wonderful interview. I've learned so much.
Thank you.
And what's the best location for our audience to contact you?
The best place to find me is actually on my website at drtoomer.com. That's drtoomer.com, or on YouTube and Facebook, also Dr. Toomer. I'm pretty much Dr. Toomer everywhere. So Dr. Catherine Toomer, Catherine with the C, and Toomer with 2 O's. So that's the easiest way to find me.
Thank you so much. So that's the end of this episode. Thank you very much. We had a wonderful guest, Dr. Toomer, and we'll disconnect shortly.
Okay.
Thank you.